I'm Nino Butskhrikidze. I'm from country of Georgia. My background is internal medicine. I'm medical doctor, physician, and nowadays I'm working in medical corporation AVEX as a quality management group leader. I'm related to the emergency medicine in Georgia because I was the coordinator from the Georgian part of the special project running by the Emory University in Georgia to develop the emergency medicine in our country. So that's why I'm involved in the emergency medicine development in our country. The history of emergency medicine in Georgia started in 2005 when the first emergency medicine department, pediatric emergency department, was opened in Iashvili Pediatric Hospital in Tbilisi. After this, in 2007, was opened the first adult emergency department in the Central University Hospital, we started the activities related to emergency department in our hospital. The physicians from different specialties, mostly critical care specialists, started working in emergency department of our hospital, and after several years, 2 or 3 years, we realized that it's not enough for our department, and we started looking for the ways how to improve our activities, and we realized that we need the special training program for our emergency physicians. In collaboration with Emory University, we started subspecialty training program at our hospital, and in these programs were involved physicians from our department, and also were involved physicians from other hospitals, cardiologists, surgeons, and so on. So the first group was started in 2009, and this was a 8-month training program, intensive training program, and then at the end they took the board exams, and from 10 physicians, 8 of them were certified for the time as an emergency physician. And board exams was organized by the colleagues from US. They especially were invited in our country, and they took the exam in emergency medicine. So it was the first experience for us how to run the training program, and then how to certify the physicians in this specialty. After this, another group started as a subspecialty training class, and then we realized that it's also not enough for us, because according the regulations, anyway, our emergency physicians were allowed just to work in the scope of their original specialty. That's why we decided that we need the independent specialty with its own scope of practice, and we started working on it with the Ministry of Health in Georgia, and finally in 2012 emergency medicine in Georgia became as an independent specialty with its own scope of practice. After this 3-year residency program was created based on the subspecialty program, and by itself subspecialty program was based on US curriculums, society's curriculums, and in 2012 the first residency program in adult emergency medicine was started in Georgia, and after 1 year we will have the first graduation of this class, of this course. So it's a brief information about emergency medicine in Georgia, and it happened because we had support from the top management of the hospital for that time, and from the Ministry of Health, and by support our colleagues from US, from Emory University and USAID, this happened, and nowadays we have the new specialty in our country. Before, in our countries, all hospitals were functioning as it was in the Soviet period, and all hospitals had just admission department. There was a problem with the patient flow in the hospitals. Hospitals had excess number of beds and physicians. There was no triage in admission department, and patients were admitted just based their chief complaints, and there were a lot of errors related to the hospitalization, related to the there was not performed the initial workup. That's why most of patients were admitted without any preliminary diagnosis, just based on the complaints. After there was a lot of consultations in the admission department, and by itself the staff of the admission department were included different specialists, and there was excess number of physicians in admission department. That's why we decided to improve the patient flow at our hospitals, and we hope that emergency departments will help. And another reason was to improve the care of critical ill patients, and to decrease the length of stay of the patients in the hospital, and to decrease the number of consultations in the admission department. And from our point of view, the admission department was the best choice to reach our goals. That's why we started emergency department in our hospital. Of course, it was very new for our medical societies. That's why there was a lack of knowledge. What does it mean, emergency medicine, among our medical societies and among our physicians, but step by step they realized that emergency departments helped a lot, and it not only improves the care inside the emergency department, but at the same time it improves the care outside of the department, and patients are better prepared for hospitalization, and not all patients are admitted on the floors, and that's why the hospitals have the possibility to keep the beds for the patients who really needed to be admitted in the hospital. And nowadays, by our regulations, it's mandatory for hospitals to have the admission departments in the hospitals, but the problem is that we don't have enough number of certified emergency physicians, and Ministry of Health decided to have the transitional period for this time, and nowadays, besides the emergency physicians, other specialty physicians are allowed to work in emergency departments, but they are working in their own scope of practice based on their background specialties. So, step by step, the number of emergency physicians are increasing in Georgia, and in near future we hope that in emergency departments we will have emergency physicians mostly, and they will cover any activities in the emergency department. At the end, I want to say that emergency medicine by itself in reality helps to improve the patient flow in the hospital. And in reality, the length of stay and outcome of acute patients were improved. And at the same time, it was very important for our country because Georgia is a high mountain region, and in the regions we have a lack of specialists, and emergency physicians can cover there any type of emergency, not emergency, but medical specialties, and it's very important for country like Georgia. At the same time, it improves the pre-hospital care as well, and we are working nowadays on it to coordinate the pre-hospital care and emergency care in hospital, and to improve the whole line of patients' flow. From our point of view, it's very important to share experience with other people, with representative of the other societies, and to learn from the people who has more experience in emergency medicine, like US, Europe, and other countries. And we are trying to keep good relationship with all of them, and I hope and I think it will help a lot for our society to develop emergency medicine in our country. So this is how emergency medicine was developed in our country, and we know that we have a long way of improvement to reach our goal, but I think step by step we will improve our activities and our specialty in our country. Thank you.